The biggest concern that patients have after the diagnosis of breast cancer is, where do we go from here? What do we do? We found out multiple times that patients will be anxious. There will be a significant amount of anxiety and apprehension with this diagnosis, but the more clearly and more efficiently you can lay out the treatment path, as well as give literature and reasoning to support that path, it will help with the anxiety. No one wants to be told that they have cancer, but if they know and have confidence in the treatment that's being outlined, it makes it easier to get through this very trying and stressful period. So the biggest concerns that we face here at the Alaska Surgical Oncology Breast Center is, what is the right step for this patient? How do we tailor this treatment to meet this patient's needs, as well as to give them the best chances at survival? You know, I think that it's really important that in treating the patients with breast cancer, we are not talking about just a surgical approach. We know, and the studies show, that the best result in the treatment of patients with breast cancer is when you integrate all three forms of treatment: chemotherapy, radiation therapy, and surgery. And it's the integration and the timing of the integration of these therapies that will help to get the best outcome. Number one, get the best survival for the patient, and number two, preserve the cosmetic appearance as well as function to the highest standard. And that's what I enjoy doing, is to be able to take a situation that can seem very complex, break it down into its individual parts, and lay out a plan to help guide that patient through, as well as guide the patient and their family, because this is a diagnosis, as well as any malignant diagnosis, that touches not only the patient, but the patient's family and support group. We are not just a surgical practice. We take care of the entire patient. If there's questions that they have, the patients are encouraged to call us. We will respond to the questions. We will get them the information that they need, because a lot of times anxiety is caused not only by the diagnosis, but fear of the unknown. And our goal here is to make the unknown known as much as possible.